Good morning, good afternoon, and good evening, everyone. Thank you for joining us. My name is Ariel Alexevich, and I'm a Sustainable Development Officer at the UN Department of Economic and Social Affairs. I'm joined today by two colleagues who have just released a policy brief on social policy and social protection measures to build Africa back better after COVID-19. This is part of a series of policy briefs that our department has been releasing throughout the pandemic to highlight the ways that COVID has been affecting various aspects of society and paths forward. You can read all of our policy briefs at un.org/DESA, that's DESA. But today we are fully focused on Africa, and I'd like to welcome our guests, Hanta Rafeli Manana and Meron Sharif, both in UN-DESA's Division for Inclusive Social Development, and they're the authors of this new policy brief. So welcome, ladies.
Thank you.
Yeah, it's great to have you here. I want to start by asking each of you to tell our audience a little bit more about yourselves and your background and what work you do and what you've been following throughout the pandemic. So over to you, Hanta, first.
Yes, good morning, Ariel, and good afternoon and good evening for those listeners who are in Africa. I know it's later now. It's a pleasure to be here. My name is Hanta Rafeli Manana, and I'm a demographer. And as Ariel said, I work in the Division for Inclusive Social Development. That division is part of the Department of Economic and Social Affairs at the United Nations in New York. Our division provides technical advice to governments and regional organizations when they meet to discuss about social development. And one of the intergovernmental bodies that belongs to the Economic and Social Affairs Economic and Social Affairs Council that our division serves is called the Commission for Social Development. And one important issue that is discussed during the meetings of this commission is Africa's development. Currently, I'm the focal point on African affairs in my department at the technical level. And this policy brief is part of our department's support to Africa. For my work, I usually conduct research and analysis of social phenomena such as poverty and health. And as I said earlier, when UN member states meet annually as part of intergovernmental processes, I'm part of those who provide substantive support to these UN members as well. So now I'll let Meron introduce herself.
Thank you, colleagues. Good morning, good afternoon, and good evening, everyone. My name is Meron Sharif, and I work in the same division as Hanta, the Division for Inclusive Social Development in the Department of Economic and Social Affairs. I'm a statistician, demographer by training, and my main areas of work are conducting research and analysis on social development issues and providing substantive inputs or support to the intergovernmental processes. As Hanta said, we mainly work on providing support to all intergovernmental processes such as the General Assembly, the Commission for Social Development, and the Economic and Social Council. And mostly Hanta has touched upon what we really work on. Thank you. Thank you, Ariel.
Great, thanks Meron and Hanta. We are really pleased to have you here, so thank you for your time already. But let's talk about this policy brief. This is all about building Africa back better after COVID-19. So Hanta, can you please set the scene for us and tell us in brief where Africa stood on implementing the SDGs, the Sustainable Development Goals, before the pandemic, and what has happened to SDG implementation since COVID really took hold?
Yes, Africa definitely made social development gains before the COVID-19 pandemic. For instance, it made progress in decreasing the proportion of people who live in extreme poverty. And we know that poverty eradication is the first and most important SDG. So Africa made progress there. Africa also succeeded in reducing maternal and child mortality and increasing access to education for children, and in increasing access to family planning for women, for instance. However, Africa failed to make progress in other SDGs. For instance, hunger and food insecurity had risen even before the pandemic. And despite the fact that the proportion of people living in poverty had decreased because of rapid population growth, the number of people who lived in extreme poverty had increased in sub-Saharan Africa. So in fact, the rate of progress on the SDGs in Africa was in general insufficient to meet the targets by 2020. This challenge in implementing the SDGs had been made even more difficult by the pandemic, given COVID-19 related lockdowns that resulted in economic growth contraction for the first time for Africa in 25 years. So if we measure Africa's experience of the COVID-19 pandemic by the usual metrics of positive cases and deaths, we can say that Africa's experience seems mild. But the social and economic impacts of the crisis have hit hard. For example, Africa lost an estimated, the equivalent of 60 million full-time jobs in the second quarter of 2020, and up to an additional 40 million people were pushed into extreme poverty by the end of 2020 in sub-Saharan Africa. So that's the situation.
All right, it seems like a lot of good progress was made, but a lot of it is at risk right now, definitely. Yeah. So let me turn to you, Meron. One recommendation from this policy brief calls for allocating resources towards social protection measures. So can you tell us what you mean by this phrase, social protection measures, and maybe give us some examples, good examples taken by African countries already in response to the pandemic?
Okay, thank you. Thank you very much, Ariel. I would start by defining social protection. Social protection is a set of policies, programs, and measures designed to reduce and prevent poverty and vulnerability throughout the life cycle. It empowers people to adjust to change in the economy and in the labor markets that are brought about by various shocks, such as the 2008 Great Recession or the current disruptions to the world of work caused by the COVID-19 pandemic. From experience, we know that more often than not, the poor, especially women, children, indigenous people, persons living with disabilities, tend to bear disproportionately the brunt of economic and social crises, such as the current pandemic. To help lessen the impact of the crisis on these groups, governments may introduce special social protection measures that we are talking about. So, as highlighted in the policy brief, African governments have introduced or adapted over 200 social protection measures in response to the pandemic. These measures consist mostly of free aid in the form of cash or food given to people and low-cost loans to micro, small, and medium-sized enterprises whose incomes have been severely affected by the pandemic. Other examples include provision of non-food items, an emergency shelter, health insurance for workers in the informal sector, hazard allowance to healthcare workers, and tax relief to individuals and businesses. Many sub-Saharan African countries have thus instituted new programs or adjusted the existing schemes to cover a wider section of the population, and in some cases increased the benefits. Some of the payments have been directed at the informal sector workers, groups in vulnerable situations such as older persons and persons living with disability, and of course women who have been disproportionately affected by the pandemic, given that many of them work in the informal sector and are primary caregivers. Overall, the measures taken by African governments have helped mitigate the social and economic impacts of the pandemic, although they are generally of a temporary nature.
Yeah. Thank you, Maron. Those all sound like great social protection measures, and assuredly we need a lot more help for women around the world, including in Africa. Hanta, I'm wondering, can you tell us of some other recommendations from the policy brief? I know that it was full of some great recommendations. And
yeah.
Also, I'm sorry, may I just point in for our audience at home, if you have a question for our experts, please feel free to type it into the chat box. Thank you. Hanta.
Okay, thank you, Aaron. Yes, as Maron said, the first recommendation that we had was to encourage governments to continue allocating resources to the social protection measures that they've taken to deal with the current crisis. So going forward, we recommend that African countries build on the temporary measures that they took during the COVID-19 pandemic and strengthen their social protection systems for the long term, because we've seen that what they did had a positive effect on the lives of African people. In other words, we encourage governments to make investments in social protection systems. And for this, they can use a mix of resources, of course, mainly domestic resources from taxes and contributions from workers, for example, but they should also tap into partnership, other partners like international development partners, community partners, community-based partners, NGOs, regional organizations, and so on, so that these social protection systems do not put too much pressure on the budget of governments. So the social protection of the future should include not only cash and in-kind transfer programs like they mainly did during the pandemic, but they should also include social insurance and benefits such as child benefits, for example, or social pensions for older persons. The second recommendation is the following. We think that countries should aim for universal social protection. What do we mean by that? Those are policies and programs defined nationally to protect all people throughout their lives against poverty and risks to their livelihoods and well-being, to ensure that no one is left behind. Such programs could include free aids given to people that guarantee at least a basic level of income security and access to health care for all. And finally, we recommend that governments could use the power of digital technology, such as mobile money platforms that we know are very popular in Africa, to deliver services quickly and safely, but it has to be done in a responsible way that respects individuals' privacy. So those are the recommendations.
Yeah, thank you, Hanta. Those all sound good and important. And yeah, we've all seen or heard of M-Pesa and its popularity and all of the mobile payments opportunities that they're really important, proving their use during the pandemic. So let me go back to you, Maron, and can you tell us overall which African countries have good social protection measures to showcase and maybe what we can learn from them?
Thank you, Ariel. That's a good question. I would say instead of focusing on which countries have good social protection policies or programs, let's remember that social protection policies and programs are tailored to national circumstances and levels of development. Having said that, it's important to point that it has been shown time and again that we need less than 2% of global GDP to provide a basic set of social protection benefits to all that live in extreme poverty. Evidence also shows that the minimum package of social security benefits is affordable in even the poorest countries. If we look at cash transfers, we've seen powerful impacts in different countries, such as like positive enrollment effects and school attendance duration in Zambia, positive effects on height, weight of children, and nutritional status in Malawi and South Africa. In Ethiopia, over 10 million beneficiaries were reached by the Ethiopian Productive Safety Net program, which is also a huge impact. And the main lessons learned in the past couple of decades is that putting in place an institutionalized and adequately funded social protection policy or program is very important to quickly respond and provide emergency relief to mitigate the effects of a shock such as the current pandemic. So the question is no longer which African countries are doing well, but it's rather how can African countries, with the support of their development partners, introduce social protection policies and programs that reach out to all quickly to ensure we leave no one behind.
Wonderful. Thank you, Maron. That is good advice. So we are running out of time here, but Hanta, let me ask you for your last words on what else do you think African countries can do to recover better and stronger from the pandemic? Maybe if you have some ways to incorporate different groups like young people and more women in the recovery process.
Yes, I think that we've already talked about this, but we will repeat that governments should increase public spending for social protection. They can do this through a multilateral development cooperation, as well as national and regional partnerships. We encourage them to target the most vulnerable, which include women, migrants, refugees, informal sector workers, youth, because we know that young people, a lot of them in Africa work in informal sectors as well as the women. So we encourage governments to reach out to non-governmental and international organizations for partnerships, because it's true that governments cannot do it alone. It will, it creates pressure on the budget. But if they are willing to do it and tap into these multi-stakeholder partnerships, I think that we think that it can be done. And, oh yeah, and the last thing, they can also tap into the help of community-based organizations, because we've seen during the pandemic that these organizations have helped, for example, encourage behavioral change in support of public health objectives, and they are closer to the people on the ground. So governments should also reach out to these community-based partners. So yeah, I would stop here.
Yeah, Thank you, Hanta. You know, I think you just really brought it together that achieving the SDGs and having the best recovery we can really involves every stakeholder group working towards a shared goal. So with that, I want to offer my deepest thanks to you, Hanta and Marone, for your time and your expertise today. Everybody out there, please be sure to read the policy brief, check out the specifics of these recommendations further. You can see that at un.org/DESA, that's DESA. Thank you everyone for joining us and have a wonderful day. Bye.
Thank you.
Thank you.
Bye.
Bye.